It's a pleasure to follow the Noble Lord, Lord Scriven, and to essentially agree with everything the Noble Lord just said. And I think Amendment 11 is a truly important amendment. It's something that would immediately affect well-being of people, some very vulnerable people in our community. And should the Noble Lord decide to divide the House, the Green Party will be supporting that amendment. But I'm going to speak chiefly to my own Amendment 23, which also relates to community treatment orders and calls for a statutory periodic review of them. And I think it's worth, I can see quite a number of Noble Lords in the House, just to go back a little bit very briefly over what we discussed at committee stage, how the Joint Committee on the draft bill concluded that CTOs should be abolished for people under Part 2, the civil sections, and for people under Part 3, they included a statutory review of CTOs with a provision to abolish them unless the government legislated to keep them. Now, my amendment doesn't go that far, but it does very much start from the point, as the Noble Lord just Scriven raised, quoting the Noble Lady Baroness Barker. It is likely to be at least 15 years before legislative attention returns to the Mental Health Act. That is a very long time. It's a very long time in the health of people who are going through experiences. And I should stress here that it's not essentially my initiative that brought this amendment forward. It was actually Mind that very much, the organisation that very much encouraged me to do that. And I quote from a couple of people who Mind have spoken to about CTOs, and I think we do have to think about what it is the actual lived experience is like. And I quote, "Being on a CTO is like being cornered. It is good that you're out of hospital, but only a little better because it is so intrusive," close quote. And another quote collected by Mind, someone who'd been on a CTO said it can feel like a tag that nobody can see, but you know that it's around your mind. Now, we have, through the debate on this bill, considered entirely getting rid of CTOs, and as the Noble Lord, Lord Scriven said, the Noble Lady Baroness Parmenter did make a very powerful case that there may indeed be circumstances and conditions and where they are appropriate. But what my amendment simply does is call for a statutory review so that we don't wait 15 years and then say, as we've been saying about so many aspects of what we're trying to fix now, this has been terrible for so long, we really need to do something about this. And I spoke considerably extensively, and I have to say to the Noble Lord, Lord Kamal, that I am still planning to arrange that Trieste meeting. I'm afraid I haven't got there yet. But to look at community alternatives has to be the way forward. There are models around the world where that's achieved. And if we were to have, as this requires, a review, also I'll point to Part 3 of this amendment, which looks at the impact on people from different ethnic minority backgrounds, the impact in terms of preventing readmissions, whether they provide therapeutic benefits. All of these things are there to actually be considered within a reasonable period of time. So we could actually be affecting people's treatments, improving people's treatments within a really foreseeable time, not sentencing them to 15 years. So it's not my intention to divide the House. I'm very much hoping that this might be something that this bill will be continued to work on, that the arguments for including a statutory review will become evident as the bill progresses. And so on that basis, I'd really urge Noble Lords, and particularly the Noble Lady the Minister, and I'd echo the points of the Noble Lord, Lord Scriven. My engagement in between different stages of the bills tends to be limited by the fact that I have a great many bills that I'm juggling all at the same time. But I know, and I've heard reports of how the Noble Lady the Minister has been engaging. And I hope she will bring that open mind. The Department, the Ministers will bring this open mind to the idea that CTOs are not something we should sentence when there's been so many questions and so many concerns, is not something we should be sentencing people to 15 years more of without a statutory review. So on that basis, I hope we might be able to move forward as the bill progresses.